My name is Dr. Patrick Dakum, and I'm a public health physician. I've been a public health physician now for the past 27 years, and principally working on infectious diseases. Currently, I work with the Institute of Human Virology Nigeria, and this is an institute that is an offshoot with the Institute of Human Virology in Maryland. And therefore, we have a very strong memorandum of understanding with the University of Maryland in Baltimore. Now, you have asked a question about what my views are and what advice I have on the coronavirus. Well, first of all is maybe I'll talk about it in the context of demystifying some of the things that are making the rounds. The first thing that we need to know is that the coronavirus is not something that is new in terms of a family of viruses, but is new in terms of the strain that is currently infecting people. Where is this virus coming from? Definitely this virus is not a bioweapon from anywhere, irrespective of the kind of media information that is out there related to its origin. It is a zoonotic virus, meaning it is a virus that has its home in animals, specifically the bats now. Maybe a few other animals may be involved, but it has been able to be transmitted to humans, and so you get human-to-human transmission of this virus. The second thing for us to realize with this is that now that it is here with us, it is something that can affect anybody from any race. Some people have said, oh, black people are not prone to the disease, we have resistance to it, but that is not true because there are a couple of black people that have developed it. Maybe our climate has something to do with its low spread as of now, but that does not mean we should rest our oars. Can you believe that in 2020, when we should have been talking about high scientific breakthroughs, going to the moon as a tourist, etc., we are teaching ourselves how to do the most basic thing that we learned in primary school way back in the early 60s. What is that? Washing of hands. It means then that this practice of washing of hands is not a practice that is new. It's a practice that has been there. We are reminding ourselves, but telling ourselves how to do it better. Washing my hands involves soap and water, which is the best combination, for a minimum of 20 seconds. Secondly, of course, if you are in an area that is endemic, that has already reported high cases of community transmission, you will take precautions more in those places. And the precautions that we're talking about is not necessarily everybody going about covering your nose. I come to some places here in Nigeria, and a lot of people have masks over their noses. It's not helping because it's not going to stop anything as of now because there isn't something to prevent there. You are not in a place where there is high transmission. The people that should benefit from wearing masks are people that are working in healthcare settings and people that are currently sick and have been confirmed to have this virus. Those will have to close, or people who suspect they do have it. Now, people have asked other questions that for how long would somebody be symptomless before he develops the symptoms? It's just a matter of days and sometimes up to a week. But generally, once you have been exposed, it's better to go and get a test done. The last thing that I'm going to mention, of course, is the issues related to whether a person who has been infected with the virus, after he has been treated and he is well, what happens? Can he infect other people? And so far, from a scientific point of view, we do not find any evidence for that. Of course, the other is, what if I suspect I may have the virus and I gargle salt and I take the salt, gargle it? Wouldn't it stop the spread? Some people have spread that information, but no scientific evidence proves that this is any beneficial thing for somebody who thinks he is a suspect. Once you think you have come in contact with somebody with the coronavirus, go ahead and look for where to get a test done. And once you have a test done, then you'll be able to know whether you have it or not, and you'll be able to protect yourself and protect others. I believe that we have a lot to do, even now, in not only protecting ourselves against coronavirus, but against every other infectious disease. The principles work for all of them. Well, let me also go ahead and say, please listen a lot to what the health officials, the Nigerian Center for Disease Control will continually provide information, the Ministry of Health, listen to what they ask you to do and go ahead and do it. But in the meantime, enjoy the rest of your day.